Good day everyone, good day ma'am. By the way, I am Aljun Vihar. For today's video, I would like to discuss to you the current situation of Philippine jails and prison amidst COVID-19 pandemic. As COVID-19 focuses the world's attention of infectious diseases, we have our eyes on the one of the most dangerous places for the spread of such outbreaks, the prison, where densely packed people and limited access to healthcare make it as a risky situation. Widespread transmission of an infectious pathogen affect the community at a large poses a threat of introduction of the infectious agent into prisons and other places of detention. The risk of rapidly increasing transmission of the disease within prison or other places of detention is likely to have an amplifying effect of the pandemic, swiftly multiplying the number of people affected. Infection control protocols and creating isolation units for infected patients to halt the disease's further spread are carried out in prisons and other places of detention. This factor poses an extra challenge when it comes to preventing, treating, and containing infectious diseases. Furthermore, a significant proportion of a detainee population presents vulnerabilities such as pre-existing medical conditions, example, high blood pressure, heart diseases, respiratory tract diseases, cancer, or diabetes, and the older age, which according to the World Health Organization can lead increased severity of the coronavirus pandemic if infected. Overcrowding has been a challenge for many years inside the Philippine jails. International guidance says the most important approach for the detention centers to prevent transmission of coronavirus is to impose social distancing, which is defined as the following 2 meters of separation at all times among detainees and staff, including during the meals and within the cells. It is also critically important to isolate individuals at high risk. Individuals testing positive or with symptoms consistent with COVID-19 as well as their close contacts. However, such measures are not feasible in the Philippines' severely overcrowded prisons, reinforcing the need of authorities to immediately reduce prison population. Preparedness is very important against infectious diseases, as these can potentially spread fast inside the jails and infect not only the inmates but the jail staff and visiting family members. The World Health Organization, in its interim guidance on March, recommended temperature checks, the release of detainees, and elimination of visits to prevent possibly control of coronavirus in prisons. Additional consideration include number 1, the reduction of prison population, number 2, shared accommodation, 3, systematic screening of new prisoners, 4, designation of hospitals, 5, robust health arrangements for prisoners with non-COVID illness, 6. Brief psychological interventions concerning anxiety for the prisoners and their family. And last, parity of access to novel treatment for prisons as they're considered vulnerable population. Early reports show several inmates and staff in the Philippines overcrowded prison have tested positive. There are more than 700 inmates who tested positive, and given the lackaway nature of their condition, with a shortage of resources and non-allegiance to minimum health standards, the inmates and the detainees are hidden victims of the COVID pandemic. And therefore, invisibility confronting the extremely vulnerable condition, a preliminary psychological intervention can include 1. fund more computer units and facilities for the e-dalaw, or what we call electronic prison visit program via Skype. Number 2, expedite the release of similar or related cases with light offenses. 3, attend to spiritual needs of the prisoners via virtual worship services. 4, the careful assignation of mental health workers in the COVID-19 care facility. And lastly, regularly check health regimens. The government has responsibility to protect and provide the medical treatment for detainees who are not released. The authorities should draft comprehensive plans to prevent the spread of COVID-19 outbreak in detention facilities, and do not rely on the simple lockdowns, but provide measures to protect the physical and mental health of the detainees. Prison should protect inmates and the staff while allowing detainees to have access to the family and legal counseling. And that's all for today. Thank you.